Hi everybody, welcome to Beauty Buzz with Lori. Today I have Dr. Garcia with me and we're going to be discussing post-recovery massaging. So we're also going to demonstrate this for you. So Dr. Garcia, tell us the importance of why we're even worrying about doing this particular massage after surgery.
Yeah, after surgery everybody has swelling. It's the body's response to the insult of surgery. And so what happens during the healing phase after surgery is fluid comes into the tissues. That fluid is manifested as swelling. Swelling comes in many different types. It can be lumpy, it can be even, it can be ropey. There's many different ways that patients have swelling. At the end of the day, the best way to get rid of the swelling is through mechanical compression. What you're doing is you're exceeding the pressure inside the tissues with your fingers, whether it's you doing a lymphatic massage or whether it's the patient themselves doing the recommended massaging. And as you exceed this pressure, this fluid is forced back into the intracellular spaces and it goes away a little bit quicker. So we emphasize that process for patients after surgery.
Can you do a little demonstration on
Sure.
myself so that patients can actually see, for those of us who are visual?
Yeah, so it's a very simple process. What I ask my patients to do is to always use the thumb. The thumb is the strongest finger on the hand. And the other component of this is not to use too much pressure. It's very important that you don't kill this. We don't want you to put too much pressure because that in itself can traumatize the tissues and cause even more swelling. So what I tell patients is just try it on your thigh, a little bit of gentle compression first, and that's about as much pressure as we do. So my process when we do this is I ask patients to take their thumb and go in a circle. Just go in a circle around the areas where they are lumpy. I tell them to go all the way around the face here, feel for the lumps, and just go in a circle 10 times a day for a minute each time we do this. So under the neck, we want them to compress like this in a circle and just move on to the next area. And this is more about frequency than it is about the amount of pressure. That's an important point. If you want to do it more, you can do it more often than 10 times a day. Do it 20 times a day. But the frequency is really what helps resolve the swelling.
And so you mentioned you don't want the patient to kill it. So
Right.
Can you explain a little bit further what you mean by that? Just because more pressure will actually cause more swelling, right?
Yeah, that's correct. And this is just about tissue trauma. So remember, these are healing tissues. We don't want to overstrain these tissues by traumatizing them even more because they're healing, they're more susceptible to inflammation.
Okay.
So the pressure has to be gentle, it has to be firm, but most importantly, a circular motion is really what we're looking at.
Okay.
It's not about the pressure, and I can't reiterate that enough.
Right,
Yeah.
okay. And so then another thing that you recommend in your practice, because we do a complimentary lymphatic massage
Right.
in addition to their at-home massage,
Right.
which again helps to, accelerate that healing process and reduce that swelling.
Yeah, the lymphatics are extremely important. You do those, you do a really good job with it, and I know for a fact that shortens recovery. Patients who have lymphatic massages, patients who are put on a program of lymphatic massages recover a lot quicker. I've been doing this for a long time and I have that basis for comparison with patients that actually engage you in the lymphatic massage process and patients that don't.
Right.
And I've seen much quicker recoveries when they come in and massage that fluid out.
Right. I would say that in my short time with you as well, that even in that period of time, I've been able to notice a patient who has been vigilant about doing their lymphatics versus not.
Right.
So you can tell a difference.
Yeah. No doubt.
With that. So,
No doubt.
And would you say that these are best done together with each other, or are they interchangeable?
They are. They can be. The more you do, the better. Like I said earlier, it's about frequency. So if you can complement your process, the lymphatic massage, with what a patient does
Right.
at home, that's the ideal way to deal with this.
Right.
I have many patients who just do one or the other. Obviously, that's going to affect less of a change, but the more the better with this.
Right. Well, I know in the part of practice that I participate in, I always do the right side of the face first with the lymphatic because it's easier to show them what it does for them.
Yeah.
And then I hand them a mirror, and that way they're able to see one side that's not been done versus the other side that has. And usually they have either their partner or husband, boyfriend, whatever with them that's been helping care for them. and they are sitting over in the corner in the chair watching, and they're watching this transition happen.
Yeah.
And they are telling the patient, oh my gosh, you wait till you see. And so when they do finally see, they're like, okay, my point of doing this is trying to show the importance of what it can do, and
Sure.
it's immediate.
Yeah.
But also, can you talk a little bit about, like, the reason we have them doing the massage so often is because 30 to 40 minutes right after they get it nice and soft and more pliable, it goes back to where it was. And that's why we want the frequency.
Yeah, that's correct. You're going to get swelling intermittently throughout your daily activities. For example, if you exercise after surgery, you're going to get facial swelling. If you lay down flat after surgery, you're going to get facial swelling. You have to live your life, and you can't stop living your life because you've had surgery.
Right.
The massages help you live your life without swelling. So yes, expect that swelling to be intermittent. Expect it to be asymmetric, always one side more than the other, and it's irregular. There's no really rhyme or reason to it sometimes. Some parts of the face get more swelling one day, and then the next day another part of the face will have more swelling. So these are the expected processes as far as swelling is concerned, but the lymphatic massage and the at-home massage are both the great equalizers. They make the whole process move quicker.
Would you say it's a accurate statement that most of your patients, if not all of your patients, want the recovery process to be done like that?
Yeah, absolutely. Nobody wants to be recovering perpetually from surgery.
Exactly.
I tell all my patients at 2 weeks, go back to your life. And that's an important reconciliation because mentally they need to recover from the surgery. And I tell them, forget you had surgery at this point. You can't do anything wrong at this point. Go about your life. Whether you worry about it or not, you're going to recover from the surgery. At that point is when we start the lymphatic massages because it will help expedite that process after 2 weeks. I think, that's an important point.
Yeah. So again, just reiterating the importance of following both pre and post-operative care instructions really is paramount to your recovery. So I hope this information has been helpful. Thank you, Dr. Garcia, for joining us, and thank you for watching.